So today we are talking about diuretics. So these are drugs which increases the rate of urine flow. Clinically useful diuretics, they also increase the rate of sodium and chloride. So first we can look into loop diuretics. As the name suggests, they act on the thick ascending loop of Henle. So this is a picture of a renal tubule. This is the glomerular capillaries. This is a proximal convoluted tubule, thin descending loop of Henle, thin ascending loop of Henle, thick ascending limb, distal convoluted tubule, and collecting duct. So these loop diuretics acts on the thick ascending loop of Henle. So if we take the individual, this is a thick ascending loop of Henle. These are the cells lining the tubule. So if you take an individual cell, it has two sides. One is a side which faces the tubular lumen, that is called the luminal side, and the other is a basolateral side which faces the interstitium. So before going to the mechanism of action of loop diuretics, we can see the transporters present in the cell. So this is an individual cell. It has both sides, that is the luminal side and the basolateral side. On the luminal side, on the basolateral side, it has an ATP transporter, that is a sodium potassium ATPase. It pumps 3 sodium outside the cell into the interstitium. This is the basolateral side, into the interstitium, whereas potassium is pumped into the cell. On the luminal side, it has a sodium potassium 2 chloride symporter, which transports sodium, potassium and chloride into the cell. So there is a influx of potassium into the cell from both sides. So the cell is rich in potassium. So in order to compensate it, there is a potassium channel on the luminal side which pumps the potassium from the cell into the tubular lumen. This movement of potassium into the lumen drives the cations from the luminal side into the interstitium, that is the calcium and magnesium. So due to the movement of potassium into the lumen, it drives the other cations from the lumen to move into the interstitium, but it doesn't they goes through a this is a transcellular pathway, that is through the cell, whereas calcium and magnesium goes through the paracellular pathway. So that is about the potassium. Now sodium, potassium, we talked about both sodium and potassium. Then there is a 2 chloride. Since the chloride enters from the lumen into the cell, and the cell is rich in chloride, there is another channel on the basolateral side which pumps the chloride into the interstitium. So now coming to the loop diuretics. So they act by inhibiting the sodium potassium 2 chloride symport, the thick ascending loop of Henle. So what happens? There is no movement of sodium, potassium and 2 chloride into the cell from the lumen. So the the fluid is rich in sodium and chloride. Sodium, chloride and potassium. So what happens? The sodium and reaches into the distal convoluted tubule, collecting tubule, etc. So normally how does sodium get absorbed? 65% of sodium is absorbed in the proximal convoluted tubule, 25% is absorbed in the thick ascending loop of Henle, 7% in distal convoluted tubule and 3% in the collecting duct. So since sodium and chloride is not absorbed in the thick ascending loop of Henle, it goes into the distal part of the tubule, but it does not have the capacity to reabsorb sodium to that extent, to greater extent. So large amount of sodium, chloride is lost, which is called the natriuresis. So it is a high ceiling or a highly efficacious diuretic. Similarly, potassium, the last slide we potassium is also not reabsorbed. It also lead to the loss of potassium in urine. The exact mechanism how potassium is lost, we can see it in when we are discussing of other class of diuretics. Since we like we saw the since there is no movement, this since this inhibits the sodium potassium 2 chlorides imported, there is no movement of potassium into the cell. So the movement of potassium from the cell into the lumen is also inhibited, which in turn inhibits the movement of calcium and magnesium. So calcium and magnesium is also lost in the urine. So there is a loss of calcium and magnesium. Since calcium is lost through urine, it can be used in conditions like hypercalcemia, but it has to be used along with normal saline, because if we use only IV loop diuretics, it can lead along with calcium water is also lost, so it can in turn lead to dehydration and lead to an increase in calcium, relative increase of calcium in the blood. So since calcium is lost, we have to avoid this in postmenopausal osteopenic movement, otherwise the bone health. So that is all about the mechanism of action. Now we can see about the adverse events.